Brilliant. Hello and welcome to our live talk on health and nutritional science at ATU Sligo. My name is Sarah Kearns and I'm the online marketing officer here at ATU Sligo, and I'll be your host for this live talk. So today I'm joined by Dr. Rochelle Burns, lecturer in health information technology in the Department of Health and Nutritional Science at ATU Sligo. Welcome, Rochelle.
Thanks, Sarah.
Hello. I'm also joined by Maura McCallion, lecturer and programme coordinator of the Level 9 Certificate in Public Health in the Department of Health and Nutritional Science at ATU Sligo. Welcome, Maura.
Thanks, Sarah. Hello, everybody.
And finally, I'm joined by Natasha Kelly, sports scholar and graduate from our online Masters of Science in Health Promotion Practice at ATU Sligo. You're very welcome, Natasha.
Thanks, Sarah. Hi, everybody.
Brilliant. So today we'll be chatting about some of the online and part-time courses open for application within our Department of Health and Nutritional Science. We'll be chatting about the progression opportunities, entry requirements, springboard, key dates, and we'll also be chatting to Natasha, who will be giving us an overview of what it's like to be an online learner at ATU Sligo. So we've had a very busy time recently. IT Sligo have recently partnered with GMIT and NYIT to form one of Ireland's largest multi-campus universities, Atlantic Technological University. We were formerly online learning at IT Sligo, and now we are online and flexible learning at ATU Sligo. So before we get started, I just need to mention some housekeeping. So this session will be recorded, but attendees will not be visible. Our talk will last for about 20 minutes. We're not taking any questions within this talk. However, if you want to head over to the live Q&A section of our virtual open evening platform, you can submit any questions there and our team will get back to you, or you can email admissions@itsligo.ie. So firstly, we'll go to you, Rochelle, and you're going to be chatting to us about the online part-time certificate in practices in health informatics, which is a level 6 course. So can you tell us a little bit about this course, Rochelle?
Yes, thank you, Sarah, and hello, everybody. So this program is developed to answer an unmet need within current workforce in the health sector, both nationally and internationally, and it focuses on giving individuals that basic understanding of what is information in health, how is it identified, how is it gathered, how we analyze it, and how it helps to fuel changes within the healthcare system and also improve health outcomes for individuals, patients, carers, and society. So the course itself is designed to give people that introduction into the areas of health information that are relevant for understanding the functionality and the workings within the healthcare sector. So in terms of the modules that we deliver in the program, there's in semester 1, there's 3 modules, and one of them is healthcare systems, which gives you an overview of how healthcare systems are constructed, how they work, how they're funded, and how they function. And then comparing across healthcare systems and comparing the outcomes associated with these healthcare systems. Just to give that overview of what a healthcare system is, how it works, how it doesn't work, and how do we fix it when it doesn't work. The second module then is fundamentals of health economics. And that module goes into the financing element of healthcare systems a bit more. How do we fund healthcare? How do we make a decision to fund one drug versus another drug? How do we improve patient outcomes when we have that fixed budget? So there's a lot of interesting things that are delivered through that module, especially since the whole COVID pandemic has changed the way in which we fund public health, particularly, and what we can do to build better functioning and more efficiently funded healthcare models going forward. And the third module in semester 1 is applied health statistics. So that gives you an understanding of getting the data, analyzing the data in order to be able to highlight inefficiencies in outcomes or where that unmet need is, or to solve solutions to problems that we don't really know about. And I think everyone has had that introductory understanding of health data, given the way in which the government has updated us over the last couple of years about the changes during the COVID pandemic. And in semester 2, then there's 2 introductory modules. One is an introduction to health informatics. So how all the data that we capture across the patient pathway comes together to improve health outcomes. And then the other introductory module is about e-health. So how embedding digital transformation within the healthcare sector will change the landscape of healthcare delivery, and understanding the concepts and fundamentals involved in that e-health setting.
Okay, brilliant. Thank you. So what are the entry requirements for this program, Rochelle, and who should apply?
So this is a level 6 program, and it's a part-time basis. So we just seek a level 5 qualification, and that qualification can be a Leaving Cert that has a pass in maths, or it can be a level 5 program that has some level of business or computing or mathematics or logic. So there has to be that kind of level 5 requirement of some numeracy related discipline at a pass level. But generally, we haven't had applicants previously that we wouldn't have accepted, because provided that level 5 qualification with some level of numeracy or logic is there, we would accept them onto the program.
Brilliant. Okay. And then I know we get asked this question quite a bit from people when they're researching online part-time programs, but how much time should people expect to dedicate to this course?
So in semester 1, you have 3 modules a week. So 3 evenings a week you'll have modules. And in semester 2, there's 2 modules, but one of them is a longer module, a 10 ECT module. So it's a couple of hours a night rather than 1 hour a night of a lecture. So when the rough estimate, when we are looking at, 15 ECTs each semester, is about 7 hours per 5 ECTs. Now that's overall. So they'll have an hour of lecture, an hour of a practical for each 5 ECT module. So that's about 6 contact hours a week. And then there'd be an expectation that they'd be doing a few hours per module as well on their own in terms of study. So because it's a part-time program, it's considered half of a full-time program. So if you think about a full-time program, it is pretty much a 30 to 40 hour a week investment. So there would be approximately a 20-hour investment, but one week you might have 5 hours, another week you might have deadlines, and it could be a little bit more overloaded. But we do offer a flexible learning environment. So students don't have to attend live lectures. They don't have to attend live practicals. Everything is recorded. Everything is available on the virtual learning environment. And all of the continuous assessment is planned from week 1. So you do know the weeks that will be quite busy, and you can kind of organize your time around trying to make sure that you have ample time when you have assessments due. So we do try and work with the student groups as much as we can to ensure that flexible learning environment, and that there's enough time for scheduling the high volume peak periods.
Brilliant. Okay. So that was one of my questions actually. So is there any on-campus attendance then for this course?
No, this is entirely online, and all assessments are done virtually as well.
Brilliant, brilliant. Okay, so this course has been approved then on Springboard this year. So can you tell us a little bit about Springboard and what are the benefits of doing a Springboard course?
So Springboard is a fantastic initiative that allows access to a range of third level programs for individuals who might have the largest impediment of attaining these courses is the financial outlay. So Springboard assesses hundreds and hundreds of applications across institutions in the country, and then selects the ones they deem are, in meeting the criteria of unmet need. And it covers either 90% or 100% of the overall fees. So with this program last year, as far as I remember, it covered 90% of the fees, which means the student contribution was only 250, I think, was the student contribution, which means that you're getting a third level part-time course, for 10% of the price. So it definitely improves access. It also, it's a motivator to continue on. So by getting into a course that is Springboard funded, you're piquing your interest in education, and potentially that you go on and do further courses after that. Some of our current level 6 graduates that have just finished up their exams, they're already looking, okay, where's the next level 7 program I can go to? Because they found the whole process so interesting and so rewarding. that they want to continue on to do more next year.
Great. So that actually leads into my next question then. So is there further progression opportunities for study at ATU Sligo then for graduates of this course?
So for this program specifically, there is a level 7 part-time program. Now it's actually not running this September, but it will be running September 12 months. So for anyone who wants to go and do this level 6 program this year, next September, there'll be a part-time level 7 in health data analytics, which is I suppose, the next step in terms of understanding healthcare data from an analytical and modeling perspective. It's a lot more applied, a lot more applications-based, a lot more, critical thinking, thought focused, and it kind of, I suppose, leaves for this level 7 takes off. It goes into more advanced statistics, more advanced health economic modeling and data mining. So the graduates off that have found that very interesting, particularly those working in industry, working in the healthcare sector, because it really gives them those skills that they need to advance their own careers as well.
Brilliant. Okay. So this course is currently open for applications on the ATU Sligo website then for September 2022 start. Yes. Brilliant.
Yes.
Thank you so much, Rochelle. That's great. Okay, perfect. So Maura, you're going to be chatting to us about a very exciting new course that's just recently launched at ATU Sligo, the Level 9 Certificate in Public Health. Can you tell us about this course and why was this programme created?
Hi, yes, Sarah. This is a new postgraduate certificate in public health. We all know a lot more about public health as a result of the last 2 years and the pandemic, but we had actually begun discussions about developing this program prior to the pandemic. So this program is in terms of public health. Public health is very broad. We think about it now in terms of infectious diseases. So a key part is about kind of protecting our health from infectious diseases and indeed other environmental health hazards. But we also, public health takes a prevention approach in terms of trying to prevent disease through maybe screening or vaccinations, and also promoting health through all stages of across the life course. And then it's also part of public health is about developing effective and efficient health services, and of course important to have the data to back up all of those things. So these are kind of the different domains of public health. And so this program was developed, I suppose, to allow students to be able to take a population health approach. And we would aim this program at sort of two different sectors. One is would be kind of new graduates who might be interested in public health as a career, and then also people who are working within roles, be it within the health service or more broadly in terms of community or voluntary organisations or local authorities, or indeed in workplaces, who might like to upskill. So we have sort of two target groups in relation to the programme. So what's sort of involved in the programme? The programme sort of tries to take a very broad approach in terms of public health, and we very much developed the programme in consultation with the health service. So part of the health service now is about integrating public health across all domains. So public health isn't just relevant to public health departments, but it's relevant across different sectors of the health service. Will I talk a little bit now in terms of the kind of careers and the kind of options that are there?
Yeah, definitely. Yeah, that'd be great.
We would see sort of there are multiple options in terms of a public health career. So people may be interested in working as a public health researcher, or working in terms of developing policies, or indeed as an advocate in terms of advocating with maybe working with sort of community development organisations, and then we have sort of more health service type roles in terms of immunisation programme coordinators, working with screening, working in health surveillance or health informatics, and even working in terms of health communication as well, and health project management. So there's a range of different sort of organisations that that look for those type of posts, be they within the health service, or be they with the Institute of Public Health nationally, or within community voluntary organisations as well, or indeed within the private sector.
Okay, brilliant, Maura. Then in terms of entry requirements then for the programme and who should apply, can you tell us a little bit more about that?
Yeah, we obviously the public health is very broad, as I said, so it involves many different disciplines. So when we were looking at sort of entry requirements, typically people would think about those coming from a health background and a social health and social care background. But we would also look at people coming from other backgrounds that may influence in terms of public health. So maybe people coming from a background in relation to education, people coming from a background in terms of more sports, business. So we're open to applicants from a broad range of backgrounds, as it is a certificate. So it gives people a postgraduate certificate, an introduction in terms of graduates into public health. But we would also specifically sort of be targeting those who are already working within the health service. So maybe those working within nursing. Indeed, we've had a good interest already from that field, but also working in other roles throughout the health service.
Brilliant. Okay, and then in terms of how much time students should expect to dedicate to this course as well, can you tell us about that?
Yeah, well, the way the course is sort of structured is that each semester there are 2 modules. So they will be running on 2 different evenings, and there's a 10-credit module and a 5-credit module. Now, the 10-credit module, the first one is an introduction to public health, and then we have a 5-credit module in epidemiology, and that's in the first semester. Now, typically the 10-credit module has 2 hours of lectures, and they usually are delivered live and put up then immediately. So maybe somebody is in later that evening and not able to take it live, that they can actually they can link in. So that's sort of 2 hours for your 10-credit module and 1 hour for your 5-credit. And then typically there are other materials such as readings, maybe videos or pre-recorded lectures or other type of activities where you may have to engage in an online discussion. Those we would call our sort of asynchronous activities. So typically there may be an hour or 2 to that as well. Mm-hmm. And then, as Rochelle said, then there's assignments and assessments to be done. So those hours can be spread out throughout the semester. Some students do more work typically on as those are more due. Other people prefer to work, will work on those as they go along. So I think it depends on the week in which the course is the part of of the week as well. Mm. But definitely the hours in terms of the contact hours for the lectures are really important, and then to build in additional time for reading and then additional time for assessments also.
Brilliant. And all lectures are recorded too, so students can watch back at their own.
That's really important. And I think students often find that maybe because they can't make a particular time, or they want to replay a particular part of a lecture as well, maybe when they're doing assignments, students would say that they find that really, really useful.
Brilliant. Okay, so the certificate in public health is open for applications now, and people can apply through the ATU Sligo website for a September 2022 start.
And Sarah, can I just say one other thing is around the recognition of prior learning, that we certainly will look at that. We also have, we maybe have applicants from nurses who've considerable experience, but maybe when they trained, the degree wasn't around, so that wasn't an option for them. So certainly we consider sort of prior learning in terms of applicants who might not have a level 8 and may just have a level 7, but have relevant experience.
Brilliant, brilliant. Okay, thanks, Maura. So Natasha,
Thanks,
we'll head
Sarah.
to you next. So Natasha, you did the Masters of Science in Health Promotion Practice at ATU Sligo. So can you tell us a little bit about why you chose this course and why did you decide to do an online learning course?
So I chose ATU Sligo because I felt that this program aligned with my aspirations for how I felt I wanted my career to develop. The online learning I felt like it was a very, very good experience for me. So I work full time. I am a student athlete, so I basically train up to 15 hours a week. I have external coaching commitments, and I just felt that the flexibility was brilliant. I suppose I couldn't afford to take time off work to do a master's, but I always wanted to do a master's, and I wanted to do a master's in something to do with health and health promotion. I feel so passionately about, physical activity, female retention in sport, and with the health promotion practice, it was very broad, and I actually got to focus on what I wanted. So initially it was female retention in sport, and I finished off with a project in physical literacy and exploring physical literacy in kids and how we can develop to make them a whole person so that they'll stay in physical activity as they progress through life.
Wow, that's brilliant, Natasha. So I know you touched on it slightly there, but how did you balance your online studies, work, and then normal life? Can you tell us a little bit about that?
Yeah, I suppose time is very precious to me, but I suppose it's about making a plan. And it's focusing on your priorities at the time. So with the online learning, obviously my evenings are quite busy with external commitments. And I found that with the pre-recorded lectures, you could watch them back in your own time. So this was brilliant for me. I could watch them back. And I found as well with the pre-recorded lectures, you could keep rewatching them so it was like having a second pair of notes. So I found the flexibility just worked for me. Getting in contact with lecturers was very, very easy. And I know that they really respected that we had outside commitments, and that sometimes, you mightn't be able to hit a deadline, but it was extremely flexible. Like I would say, just don't be afraid to ask and don't be afraid to be honest.
Brilliant. Thank you so much. And then, so what do you think you gained by doing this course?
My research skills, for sure, they progressed. I suppose it showed me where my passion lies, and it showed me a clear direction of where I actually wanted to take my career. Communication skills, being able to reach out to people, and I suppose just being honest and not being afraid to ask for help. And as well, it showed me just organization. Like you have to be organized, you have to know what you want, and it's setting that time aside and using your time extremely wisely.
Yeah, and even setting time aside for like chill out time too, like being organized kind of in all aspects, isn't it? Yeah.
At 7:30, I will stop.
Relax, yeah. So you're also a sports scholar. You were a sports scholar at ATU Sligo. So how did the sports scholarship benefit you, Natasha?
Yeah, I suppose so. With the scholarship, I'm on the road a lot with work. So I'm living in Donegal, but I could be traveling anywhere with work. And I found that it was very easy for me to train. If I was passing through Sligo, I could just pick up the phone and be like, is there any chance I can jump into the track here now and use the facilities? The facilities in ATU are fantastic. They're some of the best that I've ever trained in. They're really accessible. I found that the staff couldn't do enough for me. And as well with the financial aid as well. So I'm a duathlete, so I basically train for 2 sports. So I train in running and cycling. And you can imagine it's not a very cheap sport. And with racing as well, like, I'll be traveling around the country with races. And even internationally now coming to the end of the summer. So the financial aid it really, really helped with that side of things.
Brilliant. And then any advice for anyone considering applying for a part-time online course at ATU Sligo?
I would say just do it. If it's something you want to do, once you sign up, you will find the way to do it. It is daunting at first, but once you get into the groove and you know who you need to be reaching out to, I'd say just do it. Don't be afraid to ask the questions. And if it's something you really, really want to do, once you sign up, you'll find the way to do it.
Brilliant. Thank you so much, Natasha. Okay, brilliant. I think we'll wrap it up there. Thanks, Rochelle, Maura, and Natasha for being our panelists this evening. There was lots of really good information shared there. So if you'd like to watch back, we'll upload a video of this live talk to our virtual opening webpage and you'll be able to watch back there. So in our Department of Health and Nutritional Sciences, we have 12 part-time online courses now open for application, ranging from level 6 certificate to level 9 masters. So you can view and watch academic videos for our health and nutritional science courses in the course section on the left sidebar on this webpage. So if you've any questions regarding this talk or any of our health and nutritional science courses, head over to our Ask a Question section and our team will be available to answer your questions until 9 p.m. this evening. Brilliant. Thank you for joining and thanks, guys. That was great.
Thanks.